Acute ischemic stroke remains a leading cause of mortality and morbidity in the United States, affecting more than 800,000 adults annually, leaving many with permanent disability. When a person has a stroke, treatment usually depends on what caused the problem. In some cases, despite an extensive workup, the cause of the stroke may not be evident, and the diagnosis is categorized as being cryptogenic, of unknown cause. In fact, 1/3 of ischemic strokes are of unknown cause. Key to treatment and prevention is the identification of stroke etiology. Being able to effectively diagnose stroke cause can lead to better outcomes for stroke victims. After conducting a successful clinical trial, Biomarkers of Acute Stroke Etiology, or BACE, Ischemic Stroke Lab now provides a proprietary RNA expression blood test to diagnose stroke etiology. This test takes the mystery out of cryptogenic strokes.
The biggest challenge in the beginning of starting ischemia care is that there had been a significant number of diagnostic companies that had raised a tremendous amount of money and had failed. Another challenge was that technically is that RNA expression was in its infancy, and there weren't very many companies that were using that technology to diagnose disease. The third is the size of a clinical trial that would be required in which to bring a test like ours to market. And I think that we've demonstrated over the last 9 years that we've overcome all those challenges. The spark that led to the creation of ischemia care was when I met the inventors. They really believed that they had something that revolutionizes patient care. And having spent 15 years in venture capital and private equity, as well as starting 6 companies, there really was nothing that told the story that led to what is ischemia care now.
When a stroke occurs, the immune system changes gene expression in multiple cell types. Each stroke subtype produces a unique gene pattern. Using genes validated in the BACE clinical trial, Ischemic Stroke Lab now provides a proprietary blood test to help physicians determine cause of stroke.
The BACE trial stands out because of the incredible group of people that have built the trial from the ground up. Everybody from here internally, Judy Morgan, who's been instrumental in the operation of that trial, that has recruited over 1,500 subjects and accumulated over 5,000 patient samples, to the clinicians that work tirelessly on a daily basis to recruit patients into the trial. If you can imagine for a moment that each of these 1,500 patients have had a significant event where they've had a potentially permanent neurological deficit, and somebody from that clinical trial site, could be the clinician, could be the person that's in charge of recruiting at that site, goes up to them or a loved one, and is asking this person at a life and death moment if they would like to participate in a clinical trial. Now imagine that process has gone on over 1,500 times and people have willingly volunteered to participate in something that could potentially be groundbreaking.
The ability to more clearly define the cause of cryptogenic stroke has remarkable potential for treatment and reduction of recurring events. Leveraging gene expression profiling, Ischemic Stroke Lab's unique approach to predicting stroke etiology provides a revolutionary source of information that may guide treatment decision-making. Ischemic Stroke Lab. We take the mystery out of cryptogenic strokes.